building a better Bay Area for a safe and secure future. This is ABC 7 News.
There's a big learning curve for everybody.
Stopping at the front door, temperature taking, parents no longer allowed into the building.
Half the time is spent cleaning and half the time is spent teaching.
Learning will still happen, just a little bit differently and at a different pace.
We miss the kids.
It's a big learning curve for parents and teachers and students of all ages. ABC 7 is committed to building a better Bay Area. This week, we are focusing on education and what back to school will look like for parents and students this fall.
And we are going to spend the next half hour talking with experts about how childcares and preschools can move forward or even just survive as the pandemic drags on. Zooming in today, we have Irene Byrne, director of Phoebe Hearst Preschool, Maisha Cole, Child Care Law Center staff attorney,
Gina Fromer, CEO of the Children's Council of San Francisco, and Monica Walters, CEO of Wu Yi Children's Services. I want to thank you all for joining us today and taking time to do this with us. We certainly appreciate it. And Irene, I want to start with you because we're August 3rd. School is basically upon us. What is the situation at your preschool now?
So we were fortunate enough to be able to reopen on June 1st. So we've sort of had a trial run over the past 8-9 weeks. So we're feeling pretty prepared for September, but that will bring new children, new families, a new way of doing things. We're excited about it. We're a little bit scared and anxious. I think a lot of planning and organizing is necessary for all of the childcares and preschools in the city to really be able to reopen properly. But so far, we're feeling good about it. It's a lot of work.
I wanted to ask Monica Walters, with regard to your staff, I'm sure that many were very concerned. What did you do to sort of address their fears?
Well, we were fortunate in the sense that we did receive a PPP loan, which allowed us to keep everybody on payroll, even though our centers were closed for about 3 weeks. We reopened for emergency childcare, and then we have gradually reopened, much like Irene did, from June 1st on. We've been really clear with our staff that vulnerable people are to be working remotely. We still do a lot of virtual learning with our teachers and our staff. And the teachers that are coming in are, of course, screened carefully before they enter. If they have any symptoms or signs, if they've any exposure, they need to stay home according to DPH rules. We're trying our best to really support our teachers and our staff because they are on the front lines clearly of this, and their work is essential. So there's some fear, but we've so far so good. We've been really able to serve. We have all 12 centers open. Currently have about 150 children in school, and we're expecting more again in August when we reopen more classrooms. But we're trying our best to support our staff, give them a lot of mental health support, as well as giving them some time off when they need it, just to decompress and be home with their families.
Monica, I had just a follow-up. Are you asking the kids to wear masks?
The children under 2 do not wear masks, and the preschoolers, 4 and 5-year-olds, do. We try to, yes, have them wear masks. Of course, the staff are all masked up, and we do, like Irene said, we're cleaning all the time. We're doing a lot of outdoor activities, so their kids are getting outside more frequently. And of course, everything is very, very well contained in terms of small groups, stay together, and children don't commingle with other groups. They're in their same little pod the whole time and with their same teachers. So we're able to watch very carefully any changes in their symptoms, checking in with parents every single day to see how they're doing, how the parents are doing, how their extended family is doing, because many of our children live in multi-generational families, which puts them more at risk. And so we're very cognizant of that and being very cautious about any exposures.
Yeah, and Monica, you talk a lot about supporting the teachers, supporting the families. I want to go to Gina because your organization really supports both child care providers and families. What are some of the biggest challenges you're seeing right now?
Well, I want to say thank you for inviting me on to speak about this most important topic. The one thing I want to say is that, there is no bridge to recovery without child care. And I think that is one of the biggest things that we're seeing. Pre-COVID, we had about 1,000 slots in San Francisco. Right now, we're down to about 600. So you're looking at 40% decrease in slots across our city. What we're hearing is from providers, it's affecting their businesses. From families, it's affecting how they make decisions about, what they're going to do in the future about these choices they have to make. These are tough times for providers. And I know, for family daycare providers who opened their homes and had 15 slots and now they're down to 6, this is a business choice at some point. Do I stay open? Am I going to be able to survive? Am I going to be able to take care of my own family? And so we're hearing both sides of the provider, business, incubation. We need more businesses. We need more providers. We need to maintain our slots in San Francisco. But on the other hand, families are struggling with all this information that's out there. We have a site on childrenscouncil.org that they can go to, but the calls, the questions, what happens about this? Monica talked about the stress that parents are under every day, and the fact that the choices, either I go to work or I stay home. If I stay home, I lose my house. If I don't, I go to work. I'm in this stressed out all day at work. So on both sides of it, we're really trying to make sure that families have up-to-date information, accurate, and as a person that they can talk to, and that makes a huge difference on the other side of that line when someone is calling. Also, when providers are calling, it's so much information out there. They don't know, Phoebe, there's a lot of information out there coming down from the state and the city every day. So we're trying to be that navigator, a one-stop shop for families and for providers if they need support. They should look us up.
I want to ask Maisha Cole now about the tax measure that we had. Obviously, a lot of facilities are in crisis here, in need of financial help. There was a ballot that passed a measure, the Baby Prop C measure. Where is that now? I know that it was held up in the courts.
Honestly, I'm not sure where that measure is, but the key thing about that, any measure, is that our child care field needs money. So what we all need to understand is no matter what, our child care providers have kept our economy going. Without child care, we can't work. So in order for parents to work and sustain and for California to grow, we have to have child care providers. So any way we can get money is really, really important for us to advocate for that money. And that's what we do at the Child Care Law Center. As Gina mentioned earlier, we try to work with parents and providers, and we try to work with legislators to get the legislators to understand the importance of funding childcare. We must keep childcare funded, or we won't have options for parents, and parents need options in order to work.
Yeah, they certainly do. Okay, we're going to take a break right here. We want everyone at home to join in this conversation. You can go to Facebook or YouTube to weigh in and interact in today's virtual town hall. We are taking a break on air, but this conversation continues on our live streams, including Facebook Live right now. So we'll be back on air in just a moment.
Okay, we're going to continue the conversation. I wanted to ask Irene, I think we talked about this. You've been open for now 2 months. Any cases of COVID-19?
There are going to be cases, and there's a protocol to follow. I have found DBH to be really, really helpful. We have called and spoken with the nurses. We've had some questions, and they've been really good about calling back and telling us what to do and what the protocol is. And I think it's nice, as all the child cares and preschools feel in the city, that there's support for us. If we have a question, this is very new for all of us. And there's lots of anxiety about what's the protocol for this or for that. So knowing that we have DPH to call and that they will get back to us has been really good.
I have a question as a parent. Is there some sort of a protocol for all schools in California where if X child gets COVID or teacher, then the school shuts down for X amount of time?
So I can answer that question.
Oh, yes, thank you.
So in California, I believe that what the governor has asked us to do is follow the advice of our local DPH order. So each county is different. And certainly in San Francisco, we have very clear, as Irene mentioned, very clear supports from our local DPH, who in fact established their own childcare school site hotline, if you will, and support group. So we have specific folks that are designated to work with us. And we have very specific protocols. We put together a substantial system of measures to make sure we're in compliance.
Does it seem not advantageous to be doing this by county as opposed to by state?
Each county is different, right? San Francisco has always been leading the way with the Office of Early Care and Education. We've sort of been leading the way. However,
I'm going to have to, I apologize. I asked the question and then we have to come back out on TV. So I apologize. Hang on with us.
I want my kids to go back to the classroom so that they can have a normal education this year. I don't want my kids to go back to the classroom this year if it puts, more pressure on the teachers and the administration.
I don't know what the other families have been doing at home and how safe and how careful they have been. So that makes me very uncomfortable as a parent.
I do know that our district leaders, our board, our parents, our teachers union, our teachers have been working countless hours trying to make this the best it can be for our community.
And we are having a conversation about childcare amid the pandemic. I want to address the next question to Irene. The guidelines to reopen, both from the state and the federal government, were kind of slow to get to you. How did you know what to do? And I'm just curious, did you have an inspector come and say, yes, you are doing it right, that's not right, wrong? How did that work?
Well, I think, to be quite honest, in the beginning, it was a lot of webinars through the city and through the Office of Early Care and Education, and just staying tuned into whatever other people were planning to do. And then when we eventually received the guidelines, being ready to do just what we've been asked to do at that point. We were allowed to reopen, and then after about a week or so, we did have a virtual visit from Community Care Licensing, where I went over a review of all the recommendations and what we had to do, what we had to post, the different protocols that have been put in place, taking temperatures, hand washing, how we were handling the groups. So we have small cohorts of 10 children currently together and with one teacher. And then I gave a virtual tour of our facility to our analyst from licensing. And we got the all clear to say that we were doing what we were supposed to be doing.
And you're open now, but I wonder how long some of these places can stay open. I mean, Gina, you talked about a 40% decline in spots that are available. A lot of these places can only care for a certain amount of kids because they can't be interacting with other kids. They're in their little pods. And I guess this speaks to the advocacy as well for Maisha. It's just, how can these daycares stay afloat? I know a lot of parents are being asked to foot a little more of the bill. The prices are going up. But you have maybe one parent who's working and the other lost their job. How can we keep these places open? Because, Gina, like you said, these places are so vital for Californians and for everyone, so we can get back to business.
Go ahead, Gina.
I just want to say that, there's a lot of supports for families, where you fall on the spectrum of income. It does matter. However, there are a lot of supports, and people need to just pick up the phone and make a call. It's confusing. There are parents who are in the upper, can afford nannies and things like that. They still are facing tough choices, as well as the families who have to have a spot so they can work and support their families. And so this is not an easy decision. And all of us on this call right now are faced with many uncertain times right now. But what we're doing is making sure that, one, everybody is following all of the directions. The Children's Council has childcare counselors. Monica's Wu Yi has childcare counselors that they can pick up, call individual, and they can get what they need. Care licensing is out there. I think it's coming down, it's slowing inward now. Before it was this big, massive unknown. Now we're honing in on what providers need to do, how they can access services. And there's financial support for families who can't afford childcare, and they need to give us a call because there are dollars out there that are available for them.
Maisha, go ahead. If you want to add something, I do have a question for you, Maisha.
Okay, but I did want to add, following up to Gina and Irene, the Child Care Loss Center worked really hard the past 3 months to make sure that child care providers, parents, and community members had their questions answered. So we work closely with the resource and referral agencies. We work closely with child care providers, especially family child care providers. Those are providers who provide child care in their home. and we work closely with the Department of Social Services. So it was very confusing for our parents and our providers to know what laws to follow. So Child Care Law Center became a hub for that type of information. So if providers or parents had legal questions, we had the frequently asked questions on our website, as well as we have an information and referral service where I actually spoke to over 60 providers in 1 month because I felt like people needed a resource and they didn't want to listen to an answer machine. So there are resources out there, as Gina said. There are providers out there. We must also not forget about our family child care providers who are open, who most of them didn't close, and they rely on childcare as their primary source of income. So when we're talking about childcare providers, we have to understand that they are essential workers as well, and we do have to advocate for them, and we have to advocate. We're all in this together, so we have to be a resource to each other.
All right, we're going to take a break right here, just a moment. We do want you to join the conversation. Go to Facebook or YouTube to weigh in and interact in today's virtual town hall. Okay, break on air, but the conversation continues on our live streams, including Facebook Live right now.
One of the things that I did want to point out, and this could be for either Maisha or Gina or whomever, you know, a lot of these childcare programs, those directing them are women of color, some very, you know, some older, who are putting themselves out there and barely making it. How can I as a parent support them? What can we do here in California? Because when I think of countries like Sweden, Finland, Norway, Canada, they have amazing programs. So why are we not committed in the United States or in California? So what can I do?
I can answer that question.
All right.
And it goes to an earlier question too, which was what's happening with Baby Prop C. Well, the mayor and the Board of Supervisors are putting forward a ballot measure this November, which will in fact provide this funding that we need. It will basically take the current measure that's out of litigation, you know, and put it aside for a new measure that would support us and bring us the needed money right away. So I think to vote yes on that ballot measure is very important. The other thing is to understand that, yes, advocacy. Let your elected officials know that we're not satisfied until every single child in this nation who needs essential access to excellent child care and education receives that. It should be a right for every child, and it should be a right for every parent to know that that's guaranteed for them.
Yeah, I just want to add, Monica, thank you, that you know, pre-COVID, we had about a $57 billion issue across this country about childcare. Now, we need universal childcare. We need that. We're going to continue to fight for that. So families don't have to, you know, if you have the resources, you have childcare. If you don't have the resources, your options are somewhat minimal, right? And so they get more concentrated. And so what we're fighting for really is a universal childcare system. And it's $90 billion. We need to be fighting for that across this country.
Okay. Thank you very much. We're just waiting to go back and we will be with you shortly.
I'm hesitant to go back to school because the number of coronavirus patients gets higher by each day.
I would love to be back in the classroom, but I know that it's not safe for students and teachers because of COVID. My school is planning to work from home because it's not safe at school.
It's tough hearing from all those kids. You know, they have their concerns. You know, I think it's really important that parents know that they have resources they can access. Monica, can you talk a little bit more about the Wu Yi Children's Services and what kind of services you provide so people know who they can reach out to? And I think we lost, oh, there you are. We didn't have your audio for a moment.
Yep.
Yes, continue.
Okay, hi. Wu Yi believes that nothing is more essential than excellent childcare for all children right from the start. And, you know, we also believe that it shouldn't depend on a child's zip code whether or not they access that childcare and early education, because it makes such a huge difference. So we not only do early Head Start for about 600 children in San Francisco through 12 centers, but we also have family support services. We've been delivering food, diapers, family activity learning kits throughout the whole time that we've been sheltering in place and through the safety order. We know it's particularly difficult for children in less advantaged situations because their parents often don't have a choice whether to stay home or not. And many times those kids don't have the same educational access to learning that their peers in higher incomes do. So we are really here to do 100% wraparound child support. We also have family support services for family child care homes so that they can get the training and provide the guidance for them to be able to open up. I think that one thing that San Francisco does do is we have a series of family support centers, family resource centers, and 30 of them, in fact, through the city. And we have one at WUI too. So there are resources. You could go on our website, www.wui.org, and learn about the things that we do. But again, we're partnering with parents and other wonderful organizations like Children's Council and other childcare centers because we're all in this together. And we need to have a comprehensive approach to early education for all kids. It should be every child's right in this country to have access to early education and excellent care.
And Gina, you know, eventually people will go back to work. And I fear, listening to what you're saying, I fear that there won't be enough of these centers, facilities to meet the need. So what do you tell parents?
You know, to hang in there, and that, you know, the city and the state has their back. I mean, they've been paying for slots. They will continue to pay for slots through September. It keeps getting extended because they know how important and how parents need these slots in order for us to recover. The small business, the reality is out of the 1,000 slots in San Francisco that were available, 700 of those are family daycare homes. So I can't tell a business to stay open if they're not, you know, if it's not meeting their needs. Those businesses came online and most of them are women of color, you know, and they went into the business because they love children. And now they've seen, you know, 12 slots go down to 4. And, you know, it's a struggle, but we're doing everything possible to make sure that they have what they need. They're part of a huge network. Everybody on this call is part of that network. And it is going to be a comprehensive solution to this comprehensive problem that we're dealing with. You know, our goal at Children's Council is to make sure that every child in San Francisco reaches their full potential and thrives. And we know as providers and early educators that 90% of that brain develops between 0 to 5. That's how important this is for our children. And all the providers out there, they need us to be vigilant. They need us fighting the good fight at the state. We're bearing down our wonderful governor's door to say, hey, we need to make sure that we don't lose our slots. And the last thing I want to say, in 2008, when the recession hit, we lost 40% of our childcare slots across the Bay Area. And can you imagine if that happens again? We cannot. It took us a long road to get back to where we're at pre-COVID. We're not going to let that happen. We're going to continue to fight to make sure providers can stay online. There are small grants available through Lyft and other areas to keep them going. So they got people, they're not alone on this journey. We're here. Everybody on this call is here for them to make sure that they have what they need to stay open if they can.
Yeah, that is reassuring. It's good to know that there is help out there. We're again taking a break on air. Conversation continues on our live streams, including Facebook Live right now.
As much as I would love to go back to school the normal way, if it is not safe to do so right now, then I am okay with distance learning.
I would love to go back to school and be in the classroom when it's safe and when things calm down.
We miss the kids. We miss the interaction. We miss the dynamics that happen in the classroom, the relationship building that happens.
It's a lot. And I just hope that this kind of brings us together as a community.
All right, and we are still going on our web platforms, YouTube, Facebook Live. Irene, I want to ask you, if you just have one thing you can tell parents who are freaked out, for lack of a better term, about daycare, childcare, preschool. Any reassurance for them? What can you tell them?
I would say if you're with your child in a program or with a daycare provider and pre-COVID, you trusted them and knew they were doing the best possible job for your child, you can be reassured they are doing an even better job right now. I can tell you, just looking at my own staff and faculty and the dedication that people are putting in now, they put in before and now it's multiplied 100 times. And just showing up for the children. And the most important thing for us is we want the flow of the day to still be an enjoyable flow of the day. We don't want protocols to take over or people talking about a virus. We just want it to be an enjoyable place. Children thrive best when they're with other children, their peers, in an environment. It's that social emotional foundation we're all trying to build in early childcare. And just telling parents it's there. We are still here. It just looks a little bit different.
And I'm always impressed with how resilient kids are. Monica, what's working and what has been the most challenging thing for you?
Well, definitely what's working is the staff are working really hard. And the children are actually, as you mentioned, little resilient beings, thank goodness. And they love to be together. They love to see their teachers. They want to explore. They're curious. This is the time when they are thriving on play-based education, and also many of our children, you know, come from situations where there might not be enough food at home always, or they may be homeless children, or there may be other things going on in their young lives where another set of wonderful, loving arms and engaged adults around them is very important. So their parents are struggling, and we see that. So I think what is working is that the kids that are coming back are learning, enjoying it, and the parents are really grateful.
Okay, thank you. I'm going to ask you another question, and when we come back in just a few seconds, so stand by. Oh, we're not. Okay. Challenges.
All right, we want to thank our panel of experts for taking time out of their busy schedules today to talk with us and with all of you about childcares, preschools. You can learn more about the back-to-school developments on abc7news.com and on the ABC 7 News app.
And a reminder, all week long, we'll be talking to experts in education, leaders in child development, families, and of course, teachers each day. Don't miss a Bay Area conversation about different educated related topics.
That's right. That's it for us for now. The news at 5 is coming up.